So now it's really my pleasure and honor to introduce Alan Rudolph, Dr. Alan Rudolph, who's the Vice President for Research at Colorado State University, one of the CCTSI partner institutions. Mary Maravich did mention BARDA, and I noticed in Alan's bio sketch that he actually worked at BARDA at the Department of Defense for quite a while. So this is kind of tying these presentations together. Alan is going to talk to us about lessons learned in COVID toward a future integrated health approach to resilience and agility in outbreak response. Alan, I'll turn it over to you.
Thanks, Ron, and thanks to the organizers for the invitation. Let's go ahead and go to the first slide. You might wonder how a senior administrator got onto the panel today or the keynotes. And actually, this is a time of year, if you go to the next slide, it's 25 years in my career. As Ron mentioned, I wasn't actually at BARDA, but I was at DARPA, the Defense Advanced Research Projects Agency, which was the model for BARDA's creation. And I went to DARPA at a time after a national lab in my PhD when we had discovered that the Soviet Union was really involved with an offensive program in weaponizing pathogens. The top figure is one of the production facilities in the Soviet Union, Stepnogorsk, that was producing with 30,000 people kilogram quantities of anthrax to put into missile heads as a defense against the Star Wars program that Ronald Reagan had led. There's a wonderful Pulitzer Prize book called The Dead Hand that you can see there on the left. And then you see one of the lieutenants, the second in command, Ken Alabak, also wrote some books on this. I was at DARPA when we were debriefing him. And so, my career early on started with trying to protect the US from a pandemic, in this case, purposefully perpetrated, and it presents many of the similar things we're facing now, and my perspectives on that I'll share with you. I also left DARPA, started some companies that are still developing products for pandemics. One is Cellfire, freeze-dried platelets for hemolytics, and it's supported by BARDA actually, and a misfolded protein company that worked on variant Creutzfeldt-Jakob, which was a infectious prion protein in the blood supply and also involved with bovine spongiform encephalopathy. I did run the Department of Defense and Homeland Security's biodefense and security programs before leaving government in 2003 and joining CSU. And in part, I came knowing CSU's assets in infectious diseases, and we'll talk some more about that. And let's go ahead and go to the next slide. So up front, I'd like to share with you some sort of bottom line perspectives of what we're still learning from this pandemic. And I think one of the things that in any challenge of our day, what we see is uncommon partnerships and interdisciplinary approaches. And in fact, it's amazing to see how many of our investigators on this campus and campuses, I'm sure in Anschutz and Boulder and across the nation, have come together to mobilize their knowledge and activities, people who never met before the pandemic and are now working closely together and will likely work closely together for years. Having been around this long and trying to prevent outbreaks and working on this in my career, we still don't have resiliency or agility. And I think we've experienced that in the COVID pandemic. And we've paid a lot of attention to the power of prediction over the years. We use terms like artificial intelligence and machine learning. Yet we really have oversold this so far, and we desperately need to use computationally and analytically driven tools to better predict, for example, what's the next variant that we should be most concerned about. Viral evolution is a great example of a topic we've thrown a lot of money at with exascale computing in national labs and still do poorly at predicting what will be the next noxious variant that we ought to be concerned about. And then the last talk really elevated what anybody at the bench and managing science like I have through my career, both in industry and government, that you can have all the tools in the toolbox that you want, but human behavior and the influences on adoption of health innovations are still poorly understood and poorly implemented. And we need to focus on those, just as the last speakers mentioned, with regard to bringing more equitable outcomes and greater adoption to an integrated health. And when I use the term integrated health, I think you'll appreciate that CSU, being the land-grant university in the state, having a long history of helping people here be resilient with regard to their health, is not just about humans, but it's about animals and the environment as well. We use the term One Health, which is used by many in different ways, but I used integrated health in this regard to really focus on the fact that it's really not just a human disease that we need to address when we think about resilience and agility. Next slide. Many, back up one, sorry. Many R1 universities like ours have seen a huge explosion in proposals and activity, and the amount of projects that are emanating from our campuses is really dramatic. And I just thought I'd plot ours more recently, sponsored by so many different sources of federal agencies, industry, nonprofits, and they really cover the gambit of what's needed in response. If you think about preparedness, planning, and diagnostics and surveillance, that's really up front. And then certainly countermeasures, broad countermeasures and therapeutics are when you're actually in the event, and then of course recovery and resiliency. So, you know, this is really a snapshot probably that could be shown for any of the R1 campuses in the state of Colorado, let alone the nation. Next slide. And the next slide really shows you a network analysis of the kind of partnerships that have been created across these different kinds of units on our campus, but really shows the uncommon interdisciplinary nature, the cross-sector partnerships. As I mentioned, we have a top vet school, we have a premier ag school, public health school that's integrated with John Sametstein and the units in Colorado, a School of Public Health. So the network analysis of what's gone on during COVID is really worth paying attention to, because it was a strong fabric of innovation and people who were passionate coming together for the first time and making a difference in a challenging time. Next slide. CSU was particularly well positioned because of its assets in infectious disease and the containment level. These are pictures of our Foothills campus, where we have approximately 70,000 square feet of biosafety level 3 containment space. We're part of an NIAID network of regional biocontainment labs. That map up on the left, the furthest most west green spot is Colorado State University. This is unique assets that include the ability to take into containment bats, mosquitoes, ticks, camels, host species, animal models. We studied SARS in camels and MERS, Middle East respiratory system, in containment to look at viral shedding of camels. We have very unique facilities, including a manufacturing facility that is a CGMP, good manufacturing practice facility called BioMark. This allows us, with 20,000 square feet, with 35 industry professionals, to commercialize and scale innovations. And we'll talk more about that. And in fact, these unique assets really were turned to by the NIH, by this regional biocontainment lab, which even in the day of investing in infrastructure, they're already starting to reinvest in upping the infrastructure around these containment facilities. And for good reason. We practice really top-notch safety and security around these facilities. And of course, the remaining questions about COVID origin give us, I think, real concern to make sure that we practice the best practices with regard to safety and security. Next slide. So I have a series of vignettes that are really my perspectives and a collection of aggregate data from campus and an enormous number of great people. And, you know, we talk about resilience and agility, and in yellow is really a perspective that is mine. And yet I think was shared in many of the agencies I served at the federal agencies. So, you know, we've had this one bug, one drug, one bill approach to outbreak response. Zika, Ebola, H1N1, every time one comes along, we mobilize to deal with that pathogen. We pass bills that have billions, now trillions of dollars in the case of COVID. And unfortunately, these still don't address sort of key gaps. And those gaps really are focused on more broad spectrum medical countermeasures to multiple pathogen targets, which is frankly against, in many cases, the FDA approach to approving drugs and countermeasures. And then, of course, at DARPA, we started some of the early programs, frankly, in the mid-90s on host-based therapeutics. Instead of dealing with the pathogen, why can't we address in more competent ways the ability to address host immune response to multiple pathogen insults? So let's look at a couple of cases of things that relate to that and go to the next slide. One of the most advanced projects that we have is the production of a pan-coronavirus vaccine called Solavax. Solavax uses light and riboflavin essentially to interrupt guanosine and replication of the virus, but leaves the surface of the virus in a particle way that allows for multiple immunogen responses. And so we have significant funding from the NIH in the Biomark facility to take this to clinical trials. We'll be approaching the FDA to start those clinical trials likely in late this year and looking for partnerships in the state to start this clinical trial with Solavax. The good thing about, excuse me, about Solavax is that it has a significant amount of safety and a benchtop device made by Terumo BCT that is a large biotech company in the state of Colorado that uses riboflavin and light already to inactivate pathogens in the blood supply. This is commercially available around the world, Africa, Europe, India, and is in phase 3 evaluation in the United States. So we're essentially using a known viral inactivation method with a safety profile and a tabletop device that's available to essentially create Solavax. Next slide. On the left is the guanosine photochemistry. I'm sorry, I don't have a pointer, but if you go to the GT, the treatment, the pre-inactivation and photoactivation, you'll see there's a discrepancy on the yellow and blue that shows that the GT mismatch type is highly elevated in the photo-inactivated treatment with riboflavin and light. And then if you go to the right of the second arrow on the right of this slide, you'll see that the second boost of Solavax with the CpG adjuvant in a hamster model after 21 days in the dose, the first dose and the second dose of day 42 results in a significant production of neutralizing antibodies to COVID-19. And we've looked at a number of viral variants as well now in culture, and it's showing some efficacy against multiple variants as well. I don't have that data here, but we're now collecting that data against multiple variants. Next slide. So to look at host response, we've also looked at small molecule approaches to antiviral assays, and in culture, combining our cell-based studies with animal studies to look at genome replication of the virus, cell-to-cell spread, and then plaque assays to look at essentially virus output or the neutralizing antibody production of cells that are exposed to virus and potential small molecule combinations. And so this is an approach, essentially we set up a lab that has worked with a number of industries who are developing small molecule combinations of drugs to look at safety profiles of these drugs as well as efficacy profiles of these drugs. And of course, the next slide, if you go to the next slide, shows some of the results of combining drugs in these approaches. So in this slide, drug A is ribovin, an anti-guanosine replicative drug. Drug B is an antiparasitic drug, and drug C is hydroxychloroquine. Excuse me, a controversial drug that we know because of its safety profile, but when put into combinations with other drugs, shows that we can delay infection and we can in fact reduce viral infective doses of these combinations of drugs in these cell-based models, and go on to looking at animal models with combinations like this to validate these cell-based models. This is Rishika Pereira's work in combination with Synavir, a company that is in trials in South Africa with a combination drug cocktail of these three drugs. Next slide. So one of the opportunities in host response is to look at the omics of longitudinal profiling. And you'll hear, I'll refer a couple of times in this presentation to Greg Ebel's work and Nicole Earhart and a large team, Christy Pabaloni at CSU, who have worked with the state on a senior care workforce longitudinal study. And we've got over 150,000 samples of the senior care workforce who have been sampled over time since the outbreak, people going through that asymptomatic to symptomatic and recovery, and some not getting sick at all. This actually is slides from DARPA programs that looked at longitudinal prediction of who gets disease when and who might be super shedders from a program at DARPA called Predictive Health and Disease PhD program and the DARPA Thor program, both programs that developed analytical AI encoders that we're now applying to these COVID longitudinal sample biobanks. And if you look at the left, the predictive time of disease exposure was pretty good with regard to the predictive value in the small box there of the PPV and NPVs of looking at, in this case, rhinovirus, a number of viral influenzas in a model where dormitories were used and students were inoculated with RSV to actually look at the profile longitudinally. And that in the middle resulted also in a pretty good prediction of host gene response profiling of who would be shedders and non-shedders of viral loads. And of course, the pathways that are developed of those models really are revealing with regard to not just inflammatory pathways, but phagocytic pathways. And so this approach of looking at longitudinal profiling and predictive analytics is really a strong approach to looking at host profiling. I'm sorry I didn't include the reference here. I do have references for these papers I'd be happy to provide, both on the DARPA program and what's coming out now from Greg and Nicole's lab on the senior care workforce. Next slide. So the next vignette is really about what you can do to prevent pandemics and outbreaks, and it's really the upfront work, what we call biosurveillance. And it can't just be about people, it has to be about animals and the environment to provide early warning into the threat, because you can't manage what you don't measure, and if you don't measure it early before it really hits population, unfortunately, we've seen the speed by which things move around the planet, people, animals, and these things move from one side of the planet very quickly. So, you know, things like ProMed were developed in part by Steve Morris, who left DARPA to go to Columbia University. ProMed is essentially a network of infectious disease individuals who are posting daily on their observations and surveillance. These kinds of networks and measurements really are the backbone of preventing outbreaks. So let's look at what some of the things we learned in this pandemic around biosurveillance. Next slide, please. So I think we've got some bullets here, so you may have to just animate to hit the bar, and if we don't, that's fine. So what we learned in COVID certainly was we're used to managing disease. In COVID, we had to learn that actually the asymptomatic carrying of the virus was key to the early management of disease. This is actually data from Greg and Nicole's early work, where you can see the percent of total of people they were measuring across the state and the workforce had 0 or 1 symptoms, that middle graph on the right side. Certainly those that were swabbed were carrying potential virus, and in many cases were developing neutralizing antibodies. So, you know, we were dealing with a scenario, quite frankly, that we knew could come at us, but makes it very hard to manage, partly because you can't tell who's sick. And then, you know, from a behavioral side, getting people to change their behavior who aren't sick is very hard. But indeed, you know, double-digit 13% of the healthy workers tested early for SARS-CoV-2. Many of them had high infectivity, high viral loads. Many of them remained asymptomatic. And now we've got those longitudinal samples of tracking them through those that did go on to have symptoms and then recovered. And then on the bottom, you can really see what I think was really heartwarming at the beginning is that in the management of screening asymptomatic people in this workforce and removing them from the workforce, that the prevalence of disease declined. So if you look at site C, D, and E, what you're looking at is essentially a time course of as we remove people who tested positive, prevalence of the disease in those facilities, of course, the most vulnerable populations, the highest mortality and morbidity is in our elderly, was reduced. So this is a very, I think, stark demonstration that asymptomatic management and biosurveillance was a key lesson learned in our early work with the senior care workforce. Next slide. The other thing we learned is that we knew wastewater at the containment facilities was an early warning for disease. Frankly, it's an early warning for lots of things. You can find antibiotics, you can find a lot of things in the wastewater stream, but we never knew it could be brought to the micro-resolution basis. And for those of you who are my age generation, you'll see Ed Norton there. I found this on the web. Ed Norton was in The Honeymooners, one of the more famous sewer workers on television in the 50s and 60s. And this was actually a pre-COVID quote. Your name came up in the sewer today. And, you know, Susan DeLong and Carol Willis and our chief medical research officer really been working closely with the state on the sewer shed project, but also showed us that we can bring this down to micro resolution. Next slide. So practically, we operationalized wastewater by hiring a workforce to climb down 17 sewers across a 2 square mile area of our campus 3 times a week, where we would measure viral loads of the wastewater stream. In and of itself, that's a sampling issue. Anybody who works in diagnostics knows that sample prep is one of the more significant issues to get a good sample. But this has now been worked out, and these were early signals. So we could see viral loads in the wastewater streams of our dormitories before we saw blooms of students who were tested by saliva, which was another test that we developed, a pooled saliva test, pull them out into quarantine and reduce the outbreak in those dorms. So that you'll see actually in the middle slide here, there was a dorm, one of the university dorms. We showed a viral load in the wastewater stream. We saw 6 positives by saliva screening, pulled them into quarantine, and you see the signal in the wastewater went down. And that was a way we managed essentially to keep 65% of our resident population teaching during the COVID pandemic. And, you know, we didn't close until after Thanksgiving. So, you know, and best success we could hope for in wastewater was a key element. And if we go to the next slide, we continue this work now because we can see variants in the wastewater stream, whether it's the B117 variant or the wild type. In other words, now we have probes that we can see all the variants that we need to, and we're working closely with the state and the county on our wastewater work. So the next slide is really brings us to the integrated health comment. And you know, that resilience and agility to pandemics and outbreaks won't really be solved until we close the zoonotic jump and the known gaps in disease from animals and wildlife, and environmental persistence in various ways, whether it's in soil, water sources, even wastewater streams. The next slide, being one of the top vet schools in the country, as you can imagine, we're able to really survey a wide number of animals. The red arrows on the right show you some of what you may already know. For example, civet cats, and many cat species are host reservoirs of the virus. Deer mice are a very strong reservoir. Wood rats and deer mice are strong reservoirs of viruses, as well as skunks. And the red fox and coyote work's just coming in, but red fox is showing some slight ability to shed virus, not have real symptoms, and many of these animals don't have symptoms. But you know, this is sort of again one of the holy grails that we're going to have to address is when do these things jump, and how do they jump? And this is a real challenge for our community in preventing future outbreaks. Next slide. The most recent concern that you may have seen in a Nature article that only came out last month was a study of prevalence of SARS-CoV-2 in whitetail deer. This is a survey done in Michigan, Wisconsin, and New York, and 30% of the whitetail deer that were sampled had positive antibody response to SARS-CoV-2. This is still highly controversial because how did they get it? How do we know? What does this mean? And of course, in the whitetail deer population, you have the hunters and a lot of political influences around this, but this is of real concern. And one of the entities on our campus is the National Wildlife Research Center, which we work closely with, a USDA APHIS facility. And in fact, there will be a lot of investment in understanding wildlife disease, and CSU will take part in that investment with other campuses across the country. Next slide, and my last set of vignettes is really about leveraging strengths across the animal, human, and environmental vectors of disease. There's also a relatively new set of concerns that you also have become more aware of, and that's the cyber threat regarding information flows in protecting critical information as we manage an outbreak. And we've seen not just the ransomware in hospitals and in agricultural operations, but there is a heightened sense of concern that even some of the DNA databases, the proteomic databases, can be intentionally contaminated by adversaries to throw us off of countermeasure development. So the cyber threat to health information is something that is really going to be part of resiliency and agility in thinking about the future of outbreak response. Next slide. So we've talked about biosurveillance, and yet in the COVID pandemic, because early on we knew what we were looking for, we deployed single diagnostic assays, which you now can roll into a Walgreens. You can get a viral assay, PCR, you can get antigen tested. But the reality is, if we're going to protect ourselves against outbreak response, we need to really think about syndromic surveillance. And this, again, started in DARPA in the mid-90s, where some of the technologies like backpack PCRs from companies that are now called BioFire, actually part in Colorado, have capabilities, and I think Anschutz and ourselves have bought BioFire syndromic surveillance. Now they're used mostly in the hospital when you get somebody who in the clinic who you can't figure out, can't culture what they have. But the reality is the cost per unit information in these technologies is dropping dramatically. So we can now sample for many diseases. We have essentially cartridges that allow us to look for fevers of unknown origin and do PCR for 30 or more diseases at a time for the same price as a single COVID test. So syndromic screening is really going to be the future of how we look for more efficiently for potential threats coming our way. There are other technologies that we're developing, like xenosurveillance. We're able to take vectors like mosquitoes and squash them onto a paper diagnostic platform and surveil the blood meal of a mosquito for multiple human and animal pathogens. We're using these techniques now in combination with CU Anschutz colleagues in a site in Guatemala. We're using them in surveilling in West Nile virus in Fort Collins in the Front Range. And we're starting to deploy some of these more portable technologies that allow for this kind of biosurveillance of syndromes. Next slide. The biosecurity area is something that we started and wanted to call your attention to because we have a manufacturing facility and many of the tools that we commonly have in our labs, as yours, are the site of potential threat from cyber attack. So we've already had one event around how do we protect against this. This is really a next generation workforce training opportunity as well. Our next event will be Friday, October 1st, where we've invited top leaders in the country from the FBI as well as academia and industry who are dealing with this to come and talk to us. It'll be followed by a hackathon event where we actually turn our students, computer science and molecular microbiologists, loose to both learn and teach us about what's possible. So the site at the bottom, if you're interested in joining us, we welcome that. It'll be a Friday seminar series, and then the hackathons are a weekend event with cash prizes to really gamify student incentives to help us learn about this important new area. Next slide. And I'm getting to my last slides. Go ahead and hit the last space bar. So, you know, our One Health Institute is directed by Dr. Sue Vanderwood, who is the co-PI on the CCTSI. And this will really be the site of our continued work on integrated health response. And then the next and last slide. So this is an opportunity, as Ron said at the outset, this meeting is really about building connections and collaborations. And we received a $2 million grant from the Anschutz family as a result of our pandemic work at CSU. And we are turning that opportunity into RFPs for collaborative projects with Anschutz and our colleagues across the state. So again, the site at the bottom, if you're interested, some of you have already been contacted by CSU investigators in the School of Public Health or ones that you're already working with. But we are both interested in supporting with these funds interdisciplinary projects across the state of Colorado that links us together, both in executing innovations and building graduate fellowship programs to create the next generation workforce for resilient and agile solutions. So thanks for your attention. And if we have time for a few questions before your coffee break, I'd be more than glad to answer them.
Well, thank you, Alan, for that really stimulating presentation. And I'm sorry I mentioned you at BARDA when it was actually DARPA. Maybe we'll hear about ARPA-H someday as well from you.